Hello everyone, I'm very delighted to be part of this international gathering. This is coming at a very critical moment in the history of the world, especially that the global community is being under distress due to climate change and its adverse effect within the global ecosystem. I'm going to narrow my talk on Sub-Saharan Africa, where I will share some details on how we've been undertaking the effect of climate change, specifically on mental health. We've done studies to demonstrate climate change effect on communities in Africa, but our case study narrows to Nigeria and Cameroon, and we've been able to look at how climate change, to come up with data on how climate change really affects the physical, the social, and the mental fabric of this community. I will share just a few highlights on this. Flood cases in a community in Nigeria, the Niger Delta area of Nigeria, where we've been able to undertake studies, basically looking at the baseline studies on how flooding has affected that community in terms of the physical, the social fabric of the community, as well as the mental health. And we've come up with very clear methodologies that integrates ecological techniques as well as mental health techniques. Basically, how did we do this? By taking the baseline studies, because the people in that community in the Niger Delta in Nigeria already have existential mental health problems. So it's very unlikely for us to come up with a clear statistical data that pinpoints clearly that the emotional problems and distress that they have is attributed specifically to mental health. So for the reason, we had to now take a baseline study on the mental health status of the people before the flooding and how they felt, and then during the flooding and after the flooding. So that's the only way we're able to have the net effect of the mental health problems that they have, and we could easily attribute that mental health problems that is actually as a result of flooding, which is a climate disaster. So we did this, and we're able to come up with feelings that the people experience, like emotions. So we call it eco-emotions. We have feelings and other feelings that we're trying to be able to measure, like grief, eco-morbidity, eco-mortality, deaths that are due, that as a result of the flooding as well. And in Cameroon, we also took a study as well, which is a longitudinal study in the southwest part of Cameroon, where there was a huge flooding from the Mount Cameroon. And it was very difficult for us to, in as much as we could see clearly that people were distressed as a result of that flooding. Some people lost their lives, many people lost their properties, farmlands were actually inundated totally. But then we realized that it was difficult for us to measure the community mental health effects, so we had to do a baseline studies as well. And of course, the specific methodologies that we used were basically a co-investigation. That means we, the scientists, as well as the community, we did a co-investigation. We had to do a co-understanding of the problem. That means the community as well as the researchers to understand the problem. We had to do a co-assessment of the damage that has been done. And then a co-mental health assessment, which means that the community and the individuals involved, as well as the community, we had to do a co-mental health assessment. We had to look at what is this emotions and grief that we're feeling. Is it really only attributed to the flooding and the disaster or the mayhem, or are there other issues, underlying issues like poverty or other existential family challenges that people are undergoing? So we had to make sure that whatever mental health effect that we got from this is as a result of the flooding that occurs, and nothing to do with poverty, nothing to do with other existential problems that the people have. And in doing this, we had to do a note-taking. We looked at the family history of those people who were affected by the flooding, the family history of the community, people themselves, because the mental health effect is not only on the individual, the effect is also on the community. There are people who are the observers, observing people who are actually undergoing the effect as well. They are affected in a way, they become emotional. So there is that co-emotion. What do I mean by co-emotion? Emotion that the co-emotion means emotion being affecting the people who are affected as well as the observers. And this is an intriguing area in terms of research and how to do the measurement. So we have to look at their behavioral pattern, how they behave before the flood, and now how they're behaving because of the fact that they have been affected by this calamity. So we have to look at that. And we generated the Ibanicom project. The Ibanicom project is actually a very interesting community project which is built on co-creation, co-assessment of mental health, climate challenges, co-investigation of the problem, co-intervention as well. So we have to do that, and there's a lot of observations that we came across. And then now we are basically working with Dr. Emma Lawrence on climate cares, trying to see how we can customize these lessons by looking at case studies in Africa in communities that have actually been affected by climate and climate change, especially how they are living through these emotions. Trying to catalog lived experiences, people who have lived through these kinds of calamities and how it affects their system. Trying to see what kind of research agenda we can build across Africa so that it becomes a community of practice, it becomes what we call a modus operandi, so that both psychologists and climate scientists can actually have a common ground to be able to undertake research, to understand deeper the problems, as well as to create solutions that are sustainable and possibly create early warning systems. And that's the way we think that we can actually fight climate change and reduce the burden on our mental health. I'd like to thank everyone on this seminar, and I wish all of us the best, and hopefully that we may end up generating a very sustainable global communities that we can all live in peace and have our mental health well taken care of. Thank you very much.